We will turn now to our next speaker, Joseph Joey Heffner, who's going to tell us a little bit about emotional responses towards different types of persuasive language used in public health messages and how emotional engagement relates to compliance. He sort of is tying up some of the threads of the day, really, and I very much look forward to you doing my job, as it were, and bringing things together. I can see your screen. I haven't heard you speak yet, but I'm sure that works.
Sorry, I didn't want to interrupt.
No, always interrupt. I come from a big family. We just push each other around. No, that's perfect. I can hear you, and I'm just going to make sure I can see you. I can see you. Excellent. And I think we're ready to go. I'm just going to make sure I have a spotlight on you so that you can. Yeah, so that should be ready to go. Over to you, Joseph.
Awesome. Thank you so much. Let me start by saying I really appreciate the opportunity to speak to everyone about some of our recent research, especially given some of the fantastic talks that have already been given. Today, I'm going to be speaking about the emotional mechanisms which support pro-social but not threat appeals regarding COVID-19. So as I was making this presentation, I realized how much of the conversation about COVID-19 has already evolved from the early days of the pandemic compared to the difficulties we're facing now. And given the diverse representation of this international conference, I wanted to acknowledge that the conversation about COVID-19 has probably changed across different countries. Specifically, I want to take you back to the month of March 2020, when the United States was starting to recognize the reality of the COVID-19 pandemic. Internationally, many countries had already been devastated by the speed that COVID-19 was transmitted. However, I'm from a lab in the United States, and the research today I'm presenting is from US citizens. So I'm going to be focusing on that perspective for this talk. So on March 8th, the United States had just reached over 500 confirmed cases of COVID-19, and the belief that COVID-19 would not reach the United States was quickly dispelled. On March 11th, President Trump announced new restrictions on foreign travel from Europe over COVID-19 concerns. And I remember the panic that many of our international lab members had at this announcement as people were quickly trying to find flights home. On March 13th, despite having downplayed the threat for weeks, Trump declared a national state of emergency as tensions rose. On March 16th, San Francisco became the first city to implement quarantine orders to slow the spread of the virus. And this is particularly important to emphasize as it became increasingly clear that the United States was not in a position to slow the spread of the virus with widespread testing and contact tracing. And this highlighted the beginning of a massive quarantine orders across the country. On March 25th, the World Health Organization warned that the United States could become the next epicenter as we quickly reached over 54,000 cases. And now many months later, this prediction seems to have come true. And finally, on March 27th, the CARES Act, the largest economic relief bill in modern US history with over $2 trillion allocated to try to stem the unemployment difficulties. At this time in America, COVID was still new. Everyone was still processing this information, including myself, and we didn't have clarity on the impact of what COVID-19 could be. I want to stress that the conversation we're having now is very different than the one we were having in March. We're talking now about when to advance phases of reopening, how to convince people to wear masks, and when we're going to open up schools again, if ever. But at the time, the predominant recommendation of health officials was to self-isolate through quarantine and social distance from others if required to go outside. And as such, the COVID-19 pandemic may be one of the greatest modern societal challenges that required widespread action and cooperation. Our lab studies coordination problems, and effectively the situation can be construed as a tragedy of the commons, a circumstance where we need an incredibly high rate of cooperation, but even with a small percentage of defectors or people unwilling to do their part, we're going to face devastating consequences. So the conversation popping up in our lab was the same over and over, which is how do we convince people to self-isolate, the leading recommendation at this time. Self-isolation goes against every fiber in our body as we're social creatures at heart, which some presenters have already addressed. So the challenge was how to get people to do a very difficult task, self-isolate from friends and family, as everyone's cooperation was essential for overcoming this challenge. And one of the inspirations for answering this question came on March 10th, when a very popular article came out, namely trying to persuade people to recognize the threat of COVID-19 and self-quarantine. Many of you are already probably aware of this article, but let me read through the main message. So it starts with, the coronavirus is coming to you. It's coming at an exponential speed, gradually, and then suddenly. It's a matter of days, maybe a week or two. When it does, your healthcare system will be overwhelmed. Your fellow citizens will be treated in the hallways. Exhausted healthcare workers will break down. Some will die. They will have to decide which patient gets the oxygen and which one dies. The only way to prevent this is social distancing today, not tomorrow, today. This means keeping as many people home as possible, starting now. So if you read through this text, it's very graphic and it emphasizes the threat of COVID-19. And in fact, it has some of the key characteristics of a traditional threat appeal, which is one, it has to emphasize the severity of the issue by highlighting the negative consequences. And two, it emphasizes the likelihood that these consequences will occur to the reader. And this article had an incredible impact on the internet. Remember, it was published on March 10th, and in less than 10 days, it had already received 40 million views, been translated in 40 different languages, and been publicly shared or endorsed by more than 550 prominent epidemiologists or experts. And this is a clear example of the way a situation appeals to a specific emotion, in this case, fear. And so the burning question my collaborators and I had was, would this appeal be effective in convincing people to self-isolate? Our lab studies the role that emotions and decision-making play in learning, specifically focusing on prosocial actions such as giving to charity or cooperating with others. And consequently, in addition to the simple efficacy of these public health messages, we were very interested in what happens emotionally in reading these appeals and changing public health behavior. So going to this fear and public health messaging relationship, you might think that this relationship is quite simple. But unfortunately, there are 3 theoretical relationships, all with supporting evidence that show how muddy and difficult understanding this connection can be. First, there's some evidence to suggest a simple theoretical relationship, such that increasing the evoked fear increases message efficacy and therefore behavior change. And this makes sense because fear has been shown to change attitudes and behavior by, in one mechanism, enhancing attention towards the message. And in the another, it increases perceptions of threat and self-risk. So in essence, this relationship is a simple linear relationship where more fear equals more behavioral change. However, the relationship may not be as straightforward, as evidence also supports alternative accounts of a fickle relationship, where this is a nonlinear relationship, such that too much fear can actually engage defensive avoidance and cause people to disregard the message. And too little fear can fail to produce any behavioral change because maybe it's not motivating enough. So you have this difficulty of trying to design a public health message that hits the sweet spot in terms of fear in order to be most efficacious. Finally, there's also other evidence which simply says there's no relationship at all. There's a lack of a relationship because the efficacy has been widely variable across different studies. And so this would be a flat line. However, there are alternatives to threat-based approaches, specifically prosocial appeals, such as help protect your fellow citizens. Prosocial public health messages may underscore behaviors linked to societal and communal benefits, and they may be effective at producing behavioral change. In fact, some recent preprints suggest that these very appeals may increase the likelihood of washing hands or wearing masks. So appeals that use prosocial rather than threatening language can play a potent role in public health campaigns. And it's often posited that specific positive emotions, such as hope or joy, are the important roles in the efficacy of these appeals. And extensive work has been done in the relation of positive emotions and climate change appeals, where one possibility is that positive emotions facilitate behavioral compliance because it reframes the issue as being more personally relevant and helps translate that optimism into action. So based on this background literature, this suggests that there's 2 sides of this emotion coin that can produce behavioral change through these general classes of threat and prosocial appeals. And with so much at stake regarding COVID-19 and requiring widespread cooperation, we wondered what type of appeal would be most effective, and also what are the emotional mechanisms underlying these appeals. One difficulty in designing public health messages is the heterogeneity of emotional responses that these interventions and research have. And often these intervention studies examine specific emotions, but these approaches can actually constrain a person's emotional experiences by forcing them to identify with a set of discrete emotions pre-selected by the researcher. For example, if you had a participant read some public health message, you might ask them after reading it, how afraid do you feel on some sort of Likert scale? But this imposes an emotional structure for the participant's rating, and even scaffolding the question in this manner can influence how the very emotion itself is experienced. because it construes the emotional experience as one which ought to fall into the fear category. Here, we circumvent these issues by using a model of emotion that avoids specific emotion states, but instead partitions emotional experiences into a two-dimensional space: the affective dimensions of valence, which is a pleasurableness dimension, and arousal, or an alertness dimension. So using a technique we've used in prior studies, we actually have participants rate their emotional experiences directly onto this graphical mapping of valence and arousal space after we train them on how to interpret it. So in the previous example, if a person was feeling afraid, they may choose to rate their emotional experience as unpleasant and highly arousing, although we've shown considerable variability in ratings of discrete emotional words such as afraid in our prior work. Critically, this approach has two benefits for our research question. It avoids the demand characteristics previously mentioned, and it allows the results to generalize beyond specific discrete emotions. And it also highlights two independent emotional mechanisms which can underlie these appeals: the degree of arousal or valence produced, which may independently contribute to behavior change. So here are the two messages that we designed, which were inspired by this Medium article. While I'm not going to read them both, the threat appeal was altered slightly to emphasize stronger negative consequences and personal relation to the outcomes associated with COVID-19. And the pro-social message tried to emphasize emotional appeals about the optimism of the situation if actions were taken, with an emphasis on internal efficacy, how you can take successful action, and response efficacy, how emphasizing the effectiveness of the group working together. After reading each message, participants indicated how they felt using that emotion measure I described before, as well as indicated how willing they were to self-isolate. And we also collected a baseline measure of self-isolation in a questionnaire designed to measure the extent to which participants were engaging in general preventative behaviors surrounding COVID-19. So on March 24th, again, reframing in that discussion that I had about March, the very end of it, we finished designing our study and began recruitment to collect a representative sample in the United States of 1,000 participants. And just to briefly describe the demographics, we had a very balanced gender representation with 51% of the sample identifying as female. Regarding race diversity, while our sample was majority white, we had good representation of other races, especially for an online sample. I'm sure some people are interested in geography of the United States. Well, we had a majority of the subjects came from California, Florida, and Texas, but we did receive at least one response from an additional 43 states. And finally, age was mostly on the younger side, which is again representative of online studies, but we importantly had more older participants than normal. Okay, so first let's examine the emotional reactions to both appeals to see if they evoked different classes of emotions like we had hoped. So the way I'm going to be graphing this is valence is going to be on the x-axis with unpleasant ratings on the left, pleasant on the right, and arousal is going to be on the y-axis, just the same way that participants were shown the grid. So if we look at the scatter plots, you can see a lot of variability, but specifically there's more clustering in the upper left corner in the threat responses, which indicates actual more homogeneity in the emotional responses of the participants to that threat intervention than the prosocial intervention, which was a little more variable. And if we examine the average emotion felt at the group level, which is labeled in the graph, we can see they evoke very different emotional responses. And formal tests comparing the two, now I'm going to be showing arousal and valence on the X and the actual rating on the Y. We can see that the threat intervention was perceived as significantly more arousing than the prosocial intervention. And furthermore, a little unsurprisingly, the threat intervention was experienced as more unpleasant than the prosocial intervention, which was designed that way. But critically, if we examine the absolute value of valence, we see that threat was experienced as more unpleasant than the prosocial intervention experienced as pleasant. So to conclude, we found stronger emotional reactions on both of the dimensions to our threat intervention compared to our prosocial intervention. So if you believed in this one-to-one relationship, this simple relationship of more fear, or in this case, because we didn't measure fear, more negative emotion, negative valence, and behavioral change, the threat appeal outshone the prosocial appeal on both of these dimensions. So this naturally should predict more efficacy when it comes to behavioral change. So let's look at that. So now I'm going to be graphing the willingness measure is going to be on the X, and the Y-axis is going to be the amount of willingness people had to self-isolate. So 100 was going to be completely willing to self-isolate, and 0 is not at all willing. Additionally, we did have a second behavioral measure, which was, we're labeling here change. And the question we asked participants was, after reading this message, how much did this message change your willingness to self-isolate? So 100 represented a lot of change and 0 represented no change. So if we look at our willingness results, we actually see they're almost identical. We see very high willingness to self-isolate after reading both the interventions, but the two interventions didn't produce significantly different reports on the willingness or the changes in self-isolation. But as I mentioned, we did collect a baseline, which was a question that said, I stayed home, and you rated how applicable this was to you on a 0 to 100 scale. And so we can actually use that baseline in contrast to our willingness measure. So what I'm going to be graphing here is I'm going to be subtracting the baseline from the willingness measure, where the right is going to be they indicated they were more willing to self-isolate after the message, and on the left, they are actually less willing. The message backfired in some way. So if we examine our prosocial response, we see at the group level, there was a significant shift such that people were more willing to self-isolate after reading the prosocial intervention. And the very similar effect was found for the threat intervention as well. So in conclusion, we see similar efficacy across both the interventions at the behavioral level. Furthermore, both of the interventions nudge behavior or willingness in a positive way. So we answered one question, which is simply that both of these interventions are effective. But our main question was about the emotional mechanisms underlying these interventions. So we found significant differences in the emotional reactions. We didn't find overall differences in behaviors, but next we wanted to probe how emotions facilitated this potential behavior change. So here I'm going to be showing emotional engagement and willingness to self-isolate on both the arousal and valence dimensions. So I just want to point out that these variables were standardized in order to be put into a regression model. And the regression model that I'm going to be plotting actually controls for the influence of intervention, arousal, and valence, meaning that all the effects I'm going to be showing are unique contributions of the relevant emotion dimension. So first, let's examine the simple relationships of the threat intervention. Again, going back to that one-to-one relationship, we should see that more arousal and potentially more valence should increase the willingness to self-isolate. But on both the emotional dimensions, we did not find evidence for that relationship. So it suggests that the efficacy of the threat intervention, as indexed by the willingness to self-isolate, does not actually rely on the strength of the emotional response produced. Second, we can examine the simple relationships of the prosocial intervention. Here, we see an incredibly strong association between the amount of arousal felt and the willingness to self-isolate. So if the prosocial intervention evoked a strong arousal response, you indicated you were more willing to self-isolate. And furthermore, we see a unique component of valence as well. So again, these are controlling for one another. So the more positive a person felt controlling for the amount of arousal actually also predicts more willingness to self-isolate. Finally, we have to compare, of course, the interaction between these variables in order to understand how the interventions differ. And we see that the prosocial intervention is significantly more dependent on emotional engagement than the threat intervention. So taken together, it suggests that the efficacy of the prosocial intervention is uniquely driven by emotional engagement. So what are the implications for the future? Well, we found that threat and prosocial interventions likely do not operate from the same emotional mechanisms. So just to remind everyone, the threat and the prosocial interventions were similarly effective, but the threat intervention was stronger emotionally on both the valence and arousal dimensions, but its efficacy depended less on the strength of the emotional response. So it's very likely that prosocial interventions do work through emotional engagement, but what about the threat interventions? Well, we can posit some possibilities. First is something as simple as a negativity bias, where greater weight is given to negative events. This is a very multifaceted concept, and there's many reasons why such a negativity bias could exist. One possibility is, again, selective attention, where negative events elicit a mobilization of attentional resources. So basically, there could be other mechanisms at play for the threat intervention in producing its effectiveness. The second implication is pretty important when it comes to designing a public health message, where our results imply that if you perfected the threat appeal for maximum emotional engagement across participants, it likely would not improve its success. However, the prosocial intervention, it does suggest if it were more effective at creating a positive arousing response, then it might be more effective. Finally, changing behavior without resorting to threatening language may be really important for public health officials to consider. And regarding this point, I want to take the few final moments to quickly show some additional results that we're still actively working on in unpublished data about the predictors of fear of COVID-19. So in this unpublished work, we wanted to understand what sort of variables predict fear of COVID-19. So in the first study I mentioned, we took this intervention approach, but now we're going to take a data-driven approach where we didn't want to say we think these variables are going to be the most predictive ones, but rather let the data speak to us. So first, we developed a COVID fear scale, which had sufficiently high internal consistency, and I want to show you a few of the items. So the items were things such as, I'm very worried about the coronavirus, or I have a difficult time focusing at work because of the coronavirus, and finally, I feel stressed about being confined to my house. So these all have to do with the negative emotional experiences that have been produced as a consequence of this pandemic, and potentially the rumination or the constant invasion of your thoughts when it comes to coronavirus. So using cross-validation, we split our data and retrained it on a best linear additive model using a stepwise procedure with all of our predictors in order to make sure that the end result was not overfit and to make sure that the final predictors in the model were the most robust given the data. So the way I'm going to be plotting this data is very similar to previous speakers. I'm going to be plotting the beta estimate for each of these variables as a function of the variable name. So there's a lot of data here, and I don't have time to discuss all of them in great depth, but I want to point out a couple of them that we're quite interested in. So the first two are anxiety and coronavirus media. So anxiety was a simple questionnaire about anxiety traits, and this is the strongest predictor actually of coronavirus fear. So regarding the intervention work before, one reason not to use threat-based interventions if they do produce fearful responses is that you might be exacerbating the anxieties that people are already experiencing during this time and heightening that. Finally, the second most strong predictor is the consuming media about the coronavirus. And I know other people have been talking about that. And I just wanted to put that out there that basically we're seeing a psychological profile of the type of person who is consumed with fear of coronavirus. And this probably represents many of the researchers at this time, including myself. So these variables paint a picture of a profile of a person consumed with these fears or thoughts of the coronavirus. And I just want to conclude by saying, do you have to scare people to get them to take this action? So we know people are afraid of the coronavirus. Do we have to scare them even more? Well, the US is starting to reopen, and we arguably did not receive widespread compliance with social isolation measures. And we now have a new public health crisis, getting people to wear masks. And while threat appeals mobilize society during this time might be tempting, we find that pro-social calls to actions not only create more positive emotions, but elicit just as much willingness to self-isolate compared to deploying threatening language. And maybe we can follow the example of this Duke Health ad, which the full ad is wearing a mask shows kindness. Finally, I'd like to thank my collaborators, Oriel Feldman-Hall and Mark Lee Vives, as well as the Feldman Hall lab in general. And if anyone's interested in this work, you can feel free to look at the data on GitHub, and our preprint link is below, as well as my email. Thank you so much.
Well, that was exactly what the doctor ordered, really. It was this perfect way to bring so many of the things. And I really appreciate when speakers make the point themselves that there are ties to be made across the various talks. So first of all, thank you for that, and for the really wonderful talk. Again, it's so important for anybody watching who's at the earliest stage of their career to see how essential it is to think about mechanisms. And I think you've done a really wonderful job to highlight the importance of that. I have probably more questions than we have time for, but luckily we do have some. And maybe just to start at the end, as it were, I think that graphic at the end of the masks is very pretty and great design, and as you say, quite pro-social. But do you really think that that's going to work in all cultures, and maybe even subcultures within the US? I mean, you talk quite broadly about either pro-social and threatening messages and their efficacy, but clearly who's on the receiving end is going to make a difference.
I completely agree. I think we've talked about these broad classes, and there's so much nuance. Like all the research I presented before, our data supports no relationship between fear and behavioral change, but I'm completely open to the possibility that in a different circumstance, there might actually be one. I'm just simply generalizing my results to this specific moment in time when fear was maybe at its highest. Regarding the cultural differences, I do agree that we can't know whether prosocial appeals are going to be general across cultures, but I do think different societies have shown such an amazing response. For example, South Korea at the very beginning, they took a lot of different approaches, but one of them was basically asking people to give up some sort of personal information regarding these contact tracing apps that they have in order to help the public good. So they had this widespread testing, this widespread contact tracing, and they asked basically their citizens if they would give up some things in order to help everyone else. And I think that it can be quite a powerful response if done in the right way. And I think the biggest key is actually consistency, where I think one of the reasons we're facing the problem with masks in the United States, although it's tough to say how much compliance there is, but there's somewhat of a controversy. And I think it's that the government was inconsistent at some point, where at the very beginning, they told people not to wear masks because PPE was meant to be designated for hospitals only. And now the mask recommendations are widely available. And I think the inconsistency might actually be a really troubling part about getting people to comply with public health measures.
I'm going to throw another cat among the pigeons. We talk about the compliance in other cultures, and one obvious confound is that several of those have had fairly recent and similar kinds of diseases to deal with, and so are maybe more prepared to take prosocial steps, even at the cost of civil liberties. And I think that's something we all have to think about. I mean, obviously you've controlled for a lot of things in your study, but just to play devil's advocate, do we have to be a little bit wary about, obviously taking the data as it comes, but thinking a little bit about what has come before?
Yes, I think the history provides a precedent. And actually going back to that South Korea example, one of the reasons they were so prepared is they literally had a meeting, I think in December of 2019, basically a pandemic response team had a meeting, what happens if this, and they were prepared. And they also have, they were able to continue essentially the history of other viruses in the past and carry that forward. And I think it's not a surprise, everyone knows in the United States that a lot of the funding for the pandemic response was cut, and basically we were not prepared. And I think that yes, I completely agree. Essentially, leadership starts at the top. And so even if you have these prosocial calls, which we arguably did, and I do actually believe the American people did sacrifice. I think they tried to self-quarantine. Many states, despite the government maybe not calling for a quarantine order, many states did so quite early. And I think people did sacrifice and they did call this prosocial action, but maybe it's not enough if you don't have these prepared measures beforehand. Yeah.
I think that sort of brings me to another point, which is, how big a step do you need to take from your norm to the behavior that's being asked of you? And this again is obviously very culturally dependent. But if one of the things we've been talking about is individual differences, here's an example of cultural differences. If you didn't have to change your behavior that much, then again, you talked about the intensity of the perceived threat or of the fearful measure and the repercussions that has on emotional responses. But if you're more prepared, you already know that it's doable, it's not a big shift, then you don't need as intense a message, as it were. Whereas to get people to mobilize from zero is going to take a much stronger and maybe in those cases a more fearful message. What do you think about that?
I think it's a really good point. I think that one interesting thing that I would love to learn more about is essentially, do these positive emotion appeal help people sort of realize the future in which it is all okay? Does it effectively make it easier to comply with these things? Whereas some of the things I discussed more about when you try to appeal to the threat and the individual differences associated with that, you might be hurting the very populations you're actually trying to help. Where there's some evidence from, for example, the binge drinking literature, where if you evoke shame in individuals through these ads, you can actually cause them to increase their binge drinking. So you're hurting these vulnerable populations. And so, I don't want to overstep the conclusions of this study, but I do think that it suggests that these prosocial positive emotion appeals might actually be more consistent to a broader audience and may, work on other mechanisms like making it easier for people to comply with these difficult orders. But it's a very good point.
So here's more to the mechanistic side of things. Obviously, there's a question mark as to what exactly is driving the threat if it's not emotional valence and arousal. But maybe something that's more generally playing a role is, and it's something we talked about earlier today, is that one of the reasons we have systems that process threat is to make predictions, to prepare our actions, something I've already just talked about. Is it something that we need to think about, that there might be different ways in which, depending on the cues we're given, prosocial or threatening, that we're more or less able to create these images in our mind, these predictive models, which are then going to guide our actions accordingly?
That is a fantastic question. I don't want to, I'm trying to find a way how to wrap it nicely. Well, I'll say two things. One is that the model of emotions that I mentioned, actually very famously, Brian Knutson is another popular researcher who's actually shifted that model of emotions to create something like an avoidance, avoid approach sort of underlying of the emotional response, which I completely agree with you when you mentioned these threat is meant to mobilize your resources. And it's difficult to say in these interventions whether it's going to cause you to avoid, essentially shut down, maybe in terms of this defensive avoidance I talked about, of these actions required of you. The second thing I'd like to bring up, which deals with what the point of this emotion measurement we actually made. So that in revision paper I cited was actually done because it's trying to test these predictive models of emotion. So it's actually titled, it's gone through iterations, but I think it's titled Emotion Prediction Errors Guide Socially Adapted Behaviors. And so it's something I'm very interested in thinking about, which is the extent to which people do have emotion predictions in the future, and they have emotion goal states, and they try to work their way to that. And I do think predictions and prediction errors are a critical part of how to get people to achieve their goal states, and in this case, widespread compliance with social isolation or wearing masks.
Hopefully we can talk more about this. There will be a workshop just on predictive models and threats coming up at the end of August, and we'll be in touch in case you're interested in joining that. I've been terribly remiss in not looking at the chat, where you have got some lovely comments from Garrett Fool, from Alex English, who we'll hear from tomorrow, and David Schieferdecker, who we heard from today. He suggests, what do you think about mixing threat and prosocial appeals, since they seem to work on different routes? Do they cross each other, or could they add up? And I think this is a really good question to sort of end with, because we've got our next speakers lined up.
Yes, I think the approach that we took was trying to binarize it as much as possible, but I do not want to present, there are only these two appeals. And I actually agree that, in fact, our prosocial appeal had elements that the threat appeal did. Namely, you do have to point out these negative consequences that are going to happen. But I think the key, and maybe to answer your question, maybe the prosocial is a little bit of a mix kind of inherently. You do point out these negative events, but you have to give people something to hold on to. Right? If you point climate change, for example, if you point out the devastating consequences and that's it, you don't provide the reader with any other information, I do think it causes them to shut down, because it is quite overwhelming. But I think the prosocial intervention emphasizes the efficacy of your actions and the group's actions. You today starting can do this element, and you can create the change that you want to see. And so I completely agree that maybe it isn't such a binary, but rather a mixing of the two that will create the positive response.
You just had to ask any parent, carrot and stick at all times. On that final note, thank you so much, Joseph Joey, for your talk today, to your lab for this great work. We hope to be in touch. Do maybe hop into the YouTube channel, because there are a couple comments for you there.